Hi, I'm Savannah. I'm a student nurse, and today I'm going to be showing you how to administer an insulin infusion via continuous IV, as well as do a chest tube dressing change. So, to start, I will perform hand hygiene, and I'm going to just look at my orders. So, my buddy nurse has prepared the mini bag and hung it at the bedside for me. So, I've just got my order here. Physician's order to my MAR, and I'm also going to just be looking at my mini bag there. So for first check, Bryson Scotlan, I have Bryson Scotlan on the mini bag. Right drug is Insulin Humulin R, and that is Insulin Humulin R. Right dose is 2 units per hour, The right route is continuous IV. So we're going to run it through the Baxter pump, and the right time is now. So my first check is done, so now I'm going to head to the bedside, introduce myself, and we'll get started. So, hi, my name's Savannah. I'm a student nurse. Today I'm going to be starting your insulin infusion as well as doing a chest tube dressing change. Is that all right? So the patient does have the right to refuse at this time, but because they don't, I'm going to continue. I'm just doing a general safety check when I get in here too, making sure my patient's not in distress. Can you state your name for me and your birthday? Good, so I know I have the right patient. So now I'm going to just input my rate into the pump. So we're going to do it's a primary infusion, and we're going to be using Guardian because it is insulin. Oh, and just before I continue, I just wanted to note that I did look in the PDM here, and it can be given by a student nurse, and it can be given via continuous infusion using the Guardian software. So that's how I knew what to use. It's also compatible with normal saline, which I know my patient is running right now. So, continuing on with Guardian, I'm going to scroll down till I see insulin. Okay, there we go. Insulin, select. So the prescribed rate is 2 units per hour, which is 2 milliliters per hour. So now that that's all inputted in there, I'm going to do my second med check. So right patient is Bryson Scotlan, and I'm just looking at the armband again, Bryson Scotlan. Comparing it to the mini bag, Bryson Scotlan. The right drug is Insulin Humulin R, and this is insulin right there. Continuous IV is the correct route. Right dose is 2 units per hour, which is on my label here, and it's also correctly inputted into the pump. And the right time is now. So I would get another nurse to come do an independent second check for me. She would go through all the same things that I just did so that we're on the same page. Okay, so now that the second check is done, I'm going to attach it to my patient. So I'm just going to use gloves. And I've got my alcohol swab here. So I know that my normal saline is running at TKO. I can see that it's dripping. I'm just going to follow the line along till it reaches my patient. I'm going to assess the site and make sure that there's no redness, swelling, and there's no pain. This Y port has been attached and primed for me, so I'm just going to clean it and grab my continuous infusion line. So I will swab it for 30 seconds, let it dry for 15, and I'm just making sure that this line, which has no ports, is properly primed, so I can see a bleb at the top there. All right, so before I press start on the pump, I'm going to get my buddy nurse to come and do my third med check with me. So we're going to go through the MAR compared to the mini bag, compared to my patient's armband together. So right patient is Bryson Scotlan. Right drug is Insulin Humulin R, which is what I have. Right route is continuous IV. Right dose is 2 units per hour, and that's put in there correctly. And right time is now. So once my buddy nurse agrees that this is all correctly set up, I can press start on the pump. So I'm going to confirm primary and press start. So I'm watching for 3 drips, and once those 3 drips are running, I know that it's running into my patient. So I'm gonna just make sure that I document that I've given the insulin, and I'm gonna come back and evaluate my patient, make sure they're not having any adverse side effects. Mr. Scotlan, if you're feeling any kind of dizziness or lightheadedness, please let me know right away and we can get that sorted out for you. So now that the insulin is running, I'm going to do my chest tube dressing change. So this. So I already know I have the right patient. I'm gonna perform hand hygiene again, and we're gonna do our chest tube safety checks. So my patient is in semi-Fowler's position, which is the correct position for them to be in for this. I'm coming and I'm looking at the suction, making sure that the canister is properly connected, that the suction is on, the tubing is connected properly, and that it's on continuous low, which is the green, which it is. I'm going to follow the line all the way to the drainage system. So I'm just following it. I'm making sure there's no kinks in the line. Same with over here. So we're just going to get your arm up. And I'm just going to assess the site. I'm making sure that there's no subcutaneous emphysema. It looks dry and intact, so that's good. Now, coming down here, looking at the pleura-evac system, some of the things I'm noting is the orange ball that's floating, the dry suction control. I'm looking to make sure that the water level is at the correct level, so 20 milliliters, which it is. I'm looking for tidling, so it should be tidling in and out with the patient's breath. Jacuzzi bubbles indicate an air leak, so we can check where that is coming from. I'm also going to mark where the drainage is at the start of my shift so that I can monitor its output. I'm also looking to make sure the drainage is pretty normal, so I don't want to see any frank red blood or purulent drainage. Alright, the last thing for my chest tube safety check, I want to make sure that I have normal saline or sterile water at the bedside, just in case the chest tube becomes disconnected, as well as these clamping forceps to check for air leaks. So if an air leak was to occur, I'll just demonstrate to you what I would do. So I would clamp the tubing, I would look in the window to see if the jacuzzi bubble stopped. If the jacuzzi bubble stopped, I know the leak is from here to the patient. If they didn't stop, I would clamp a little bit further down, check in the window, and if they stopped, then I know the leak is between here and here. Then you can just move your forceps down until you find the leak, and then you can tape it up with some waterproof tape. So my safety check is done. Now I'm going to get ready to do the dressing change. So perform hand hygiene, and I'm going to open up my sterile field. Okay. So, opening up my sterile field.
I have 47.
Okay. So I'm not going to need this. I'm going to just pass this to myself. And I'm just going to place my garbage here if that's okay with you. I'll get my forceps out. I'm going to need some drain sponges. So I would go get a new one. Could you grab me a new drain sponge, camera woman, please? Probably at the table. Yeah. Thank you. Okay. So, opening it up, maintaining sterile technique. I'm going to place this there. Garbage. I also need Jello net. place that there. And then just some sterile normal saline. So pour it, being careful not to splash. Okay, so now that my sterile field's set up, I'm going to put on gloves and remove the old dressing. So to remove it, I'm making sure not to turn my back to my sterile field. I'm going to pull it down, make sure it comes off. I'm going to also just make sure that I'm stabilizing the chest tube so that it doesn't fall out. Okay. Well, that would stay connected. And we'll just grab the dressing off. I'm assessing for drainage, any unusual drainage. It looks good. This needs to be taped better. Okay, so now that my dressing is off, I'm going to remove the jello net using my blue forceps. So these are sterile. And this is garbage along with that. I'm going to take off my gloves now. And I'm going to continue using sterile no-touch technique. So I'll just wash my hands again. I'm assessing the site, looking for redness or swelling. It looks good, so we'll continue with the cleaning. So using my forceps, we'll make some rosettes. Dip the normal saline. And using one swipe, I'm going to clean around the site. And around again. I'm wanting to clean around the entire area that is going to be under the dressing. And then lastly, I'm going to clean the chest tube itself. So down the tube and drop. Now I'm just going to dry it, so I use that to dry. And then I'll use a bigger gauze to dry the area. Skin, so all the way around. And so now I need to put on my jello net. And this comes between two pieces of paper there, so this can be garbage. All right, got my jello net. Okay. So now I'm going to put this around the area, making sure to make it occlusive, kind of in a donut shape. So, okay, so I'm happy with that. Okay, so now I'm going to just put on my drain sponges. So we'll put one on one way, put another on in a different direction, then a gauze, one 4x4 over top. So now I can place my cloth tape over top. And I'm wanting to make sure that the cloth tape reaches all the way around my patient's dressing because I want it to be totally occlusive. So I'm just going to squish the air out and make sure that it's all the way around the gauze. And this one I've signed and dated. So I'm going to want to tent this piece around the chest tube so that if the chest tube gets tugged while my patient's moving around, it tugs on the dressing and not on the site itself. So we'll tent around that. And then I'm going to just make sure that I'm squishing the air out. Okay, so the chest tube dressing is done. I'm going to document the care that I've given to my patient. So I'm going to document the chest tube. I've already documented the insulin that has started. I'm going to come back and evaluate my patient and make sure that they are comfortable, and I'm going to do an exit safety check. So I'm going to make sure that the bed is in the lowest position, that my patient has a call bell within reach, that the side rails are up, that they're not in any visible distress, and that's it.